a cleft is just like it's an opening in your lip, or there's an opening in the roof of your mouth. So basically, why people should know about it is because it is very common for pregnant women. I think on average for the whole world, it's between about, for every 600 to 800 pregnant women, that one or children that are born will have this kind of problem. And for children with cleft lips and also palate or they will have to suffer. I mean, they usually suffer a lot of pain, suffering, and that includes both psychological and also physiological. So this is a very common problem, medical problem. So that's why BEAM is being established to solve this kind of matters. To a certain extent, it cannot, because the exact causes of cleft problem is unknown. So, but scientists tend to believe that certain kind of behavior could increase the probability of having cleft lips or palate. For instance, like when during pregnancy, or when the mother smokes, or people having like they drink alcohol, so that's going to increase the chances of having children with cleft lips, child with cleft lips. But so in a sense, if you don't do this kind of thing during your pregnancy, then you can avoid it. But still, I mean, the occurrence is also quite frequent. Like I just said just now, it's a 1 out of 600 or 1 in 800. So in a sense, I don't think you can prevent it, but you can just try to reduce the risk a bit. For myself, I've worked for the government before, and then thereafter, I would like to join either like an NGO, or like a charitable organization. That's my own intent, my personal wish. But then also at the same time, I'm always interested in trying to have a way and a chance to help children, because I mean, children is one of the most vulnerable groups in the world. They're young, they do not have the ability to survive on their own. So I think they need a lot of help from outsiders. Most kids are likely they have their own parents to take care of them, but some children, they are not that lucky. So that's why I would like to give this chance to help them in a certain way. I think we have to look at this problem in two ways, because I think the most immediate thing is we need to recruit a lot of medical volunteers, like doctors and nurses, to do the surgeries. So in that sense, students cannot help much other than being like a volunteer to participate in our missions. But on the other side, like I mentioned just now, is that we do need a lot of resources. So I think for students, they can help, like a charity like us, to raise funds. They can appeal to the friends and then use their own network, or even talk to the parents. So in that way, they can convey the messages about cleft lip and palate to more people. So if every children is doing this kind of thing, the impact will be very great. So and then through the promotion and things like that, maybe we can raise more funds, and also increase the awareness of people who do not have a lot of ideas about what cleft lips or cleft palate is. So in that way, I think it will help a lot. Actually, for cleft lips, for cases related to cleft lips or palate, it occurred anywhere in the world. It's a very common thing, but it do varies. If the child is born in developed countries or in developing country. So on average, in developing countries, there's about 500, every 1 out of 500 to 600 cases. But in developed areas, rich countries like the United States, it's about 1 out of 700. So in developing countries, the situation is a bit worse. But still, in countries like America, they still have children born with cleft lips or palates. I think for children with cleft conditions, be it cleft lip or cleft palate, they will have two major problems. One is, I think, psychological. The other one is physical. Psychological, because they look different. Either if they have opening in the lip, it looks different from those children. So when they're growing up, most of the time they will be bullied, by their own friends or mates, something like that. So that's going to affect them psychologically. And the second thing for the physical side is that they will have difficulty to eat, to speak, and also to breathe. So that's going to affect them. And there's a lot of suffering inside. So it's not good for the children. So I think if you, for me, we do the surgeries and try to cure the problem through surgeries. So after, for instance, a child who's about 4 months old, after they do the surgery, for instance, they have cleft lips. So when they grow up, it's almost like invisible. If the operation is good, the quality is good, then people just can't tell. So at least, cosmetic-wise, they look the same, just like every children. So that will help them. For children with palate, if we can reduce the size of the hole inside the roof of the mouth, then they can eat easily, better, and also they can breathe better. So that will reduce suffering for the children.